Thank you, Dr. Angida and Sahani sir. Good evening, good afternoon, and good morning. This is the 1434th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Professor Paul Joseph from Canada. Let us begin the session with 1 minute silent prayer. Thank you all. We welcome all to the 1434th day of continuous webinar by International Forum for Promoting Homeopathy. Today, our guest is Professor Dr. Paul Joseph, who is working at Canada now and is from Sri Lanka and has made so many presentations in the forum, and all the presentations were really excellent and really a different mode, but purely homeopathy. Dr. Paul Joseph has completed a BHMS, then R.Hom from Canada, PG Diploma in Acupuncture and practicing in Toronto, former professor, Homeopathic Medical College under Tamil Nadu, Dr. MGR Medical University, India, author and writer of various medical articles and published 2 Tamil books on health and Kavades, that is poems. He is a radio host during talk show on health and politics in Gidavani for 15 years and doing talk show health at TED TV 10 years in Canada. And Dr. will be discussing about a rescue dye. That is a different subject. Let us see what is rescue dye, whether it is something related to the medicine, homeopathic medicine that works for at the bedside of a patient who is about to die, but maybe a different subject. That is what is Dr. Paul Joseph is all about. And so let us proudly welcome the guest of the day, Professor Paul Joseph. Welcome, Doctor.
Hi, everyone. I think everyone there, you are all happy and prosperous in our field of homeopathy. Good morning and good day and good afternoon to everyone. Really, it's a wonderful webinar organized by Ifph. 1434 uninterrupted, right? Unbreakable, non-stop continuing program, right? So I wish all the organizers and the regular participants, those who are regularly attend in the seminar. So myself, I have completed my BHMS in Vinayaka Missions. I think many of you know about that. At the Vinayaka Missions, when it was under MGR Medical University, then I started working as a lecturer in Vinayaka Mission. Then I joined another homeopathy college as a professor. Then 2008, I came to Canada. From that day onwards, from that year onwards, I started practice. So I will tell later about homeopathy in Canada. If you are interested, all of you welcome, because in Canada we have a College of Homeopaths of Ontario. That is like a CCH, right? In your CCS, like we have a controlling body. I am the member of the CCH, the CHO, that is a College of Homeopaths Ontario. So if you wish to practice, you can register. There's a process. Go to the website whenever you're free. Go to the website College of Homeopaths Ontario. So you can get all the information regarding how to register, how to apply, those things. So really, I requested the eminent senior speakers in the forum, or regularly those who are attending, the speakers, especially from the college, Homeopathic Medical College, right, to make the IFPH, the talks, right, they are in curriculum. So my requisition is, you have to include in the curriculum. Very interesting, very research oriented papers and topics and subjects we presented over here. Not only all over India, all over the world, they are attending and presenting paper. So you have to ask your administration, you have to ask your seniors, you have to ask the council to include IFPH talk in the syllabus of homeopathy. So that's why the forthcoming students, upcoming homeopath, budding homeopath, they can improve their interest in homeopathy. They can improve their the knowledge and the wisdom in homeopathy. So that's why my request, my plea I'm just giving over here. Did you anyone guess what topic is rescue die? Die means not die, dead, no, DYE, not DIE, DYE. Anyone guess? You can put it in the chat box. No, you can put it in the chat box. What is that? Any guess?
No.
Right, okay, that's great.
Rescue remedy in emergency. There is
No.
Dr.
Right,
There
okay. I'll check chat box. No, that's okay. So we'll come to the directly. First, I will read the case. That is in the file form, in the paper form. Then we'll come to the slideshow. Okay. A case, a lady patient, the age about 48, right? She used to visit for several complaints to me last few years. But recently, it's about few years ago, she had a lot of complaints, especially nausea, not vomiting, nausea with stomach pain, abdominal pain, severe irritation, then breathing difficulty, not that much of breathing difficulty, mild breathing difficulty, deep breathing while nausea, and weak, especially weakness after stool, weakness after every passing stool, and weakness sensation, right, every time when he pass urine and the stool. There are painless blotting sometime, and the electric shock-like sensation all over the body, and tingling everywhere in the extremities. And sometimes the burp, right? Burps comes with a loud noise and all. Sometimes she feels the fermentation-like sensation in the abdomen, distended abdomen, especially in the solar plexus, right? It's a kind of feeling, sensation. All gas and flatulency, and the palpitation, sometime on and off, frequently the palpitation of heartbeat, severe palpitation after stool. Right, very superstitious lady, believe different things and all, and very anxiety. And in the breast, there's a small nodules. They found it out through the ultrasound in the both breast. Sometimes the painful breast when they pressed, and there are some nodules in the axilla. The severe back pain, low back pain, lumbago, especially in the sacral area, severe pain in the sacral area and around those areas. And the pain little extend to the abdomen, the back pain extend to the abdomen, and hiatus hernia. She diagnosed as due to the after the ultrasound and endoscopy, they diagnosed hiatus hernia. Here in Canada, usually they won't take care of the hiatus hernia. Just they leave them. You have to live like that. There's no surgery here. And so such a things happen. Sometimes the pain in the burning and burning in the pain and in the rectum area, mild hemorrhoids and lump sensation, right, in the center of the abdomen, right? There are the, especially in the hypogastrium, center of the abdomen, lump sensation, and hypochondriasis. She always worry about her disease always, and he used to tell right the conventional doctors, the regular family doctors. They said she used to tell they couldn't able to diagnose my problem. These doctors, all the specialists, I don't know what to do. So the menopause age, 48 menopause age, she's during that period, and in abdomen, right, emptiness feeling, sometime all gone sensation, right? When you touch on the abdomen, severe pain, and she feels that ball like lump just behind the umbilicus, just beside the umbilicus, so behind the umbilicus. So heavy, so like that there are a lot of symptoms, very vague and some interesting symptom too. So that especially in the lump in the abdomen, she always feel that in the center of the abdomen. So she took all kind of different kind of medicine, different kind of specialist and all these things. So finally, she came to me and I prescribed some medicine. So before that, what happened? She went to Sri Lanka and to do the surgery, that is the hiatus hernial surgery. That's also she did. Even after that, quite a short period, maybe 1 or 2 months, she was all right. Then again, the same problem starts. Then she went to the regular doctor, the family doctor. They prescribed, they referred to her, they referred her to the psychiatrist. So she don't want to go there, and she again came to me, and then these are the symptoms I elicit, right? So this is typically the chronic fatigue syndrome. I diagnose as a chronic fatigue syndrome, and right, all the symptoms and everything. Then finally, I repertorize and I prescribe the sepia. That is a rescue dye. Sepia ink, the cuttlefish ink. So we are going to see the next slide. So this is a very interesting case. After sepia, slowly, I started with 30, then directly into the 50 millisiemen potency. She took sepia for 3 months. So completely, almost 90% of symptoms gone, and right there. So that is the story. So you see the sepia. So everyone knows. Very interesting remedy, right? Most of our homeopaths we used in various conditions, right? Sepia. So today we are going to discuss about the various unknown aspect of sepia, unknown area of sepia. This is a very interesting remedy. If you study, if you know, read sepia, if you understand the sepia well, even the 60% of female patients, you can completely heal. You can completely cure the different, the pathology. So cuttlefish can quickly change the color and the texture to merge into their background and distract the predators or attracts the male. So very interesting. That's why the sepia, the cuttlefish has ink, right? The various, they can easily mimic different types of seabed and will sometime even sink into the sand, sandy seabed to hide from the predators, leaving only their eye exposed. So even if they hide in the sand, and they just push out pull out the eyes and just seeing what's going on. Very interesting. So the same technique, the same doctrine of signature you can apply in the patient. I'll tell you later, very interesting thing. During spring and summer, the male engage spectacular display, attract females. They do the dancing and everything like a party, like a night party, that like a cabaret, like a very beautiful dance is going on in the ocean. The passing pulses and different colors rapidly along their body. Even the camouflage, camouflage, it suddenly changed the color. Different colors in one sepia, you can see. Sepia person capacity to change the color is represented by his or her tendency to appear pleasant and welcoming. Then after that, but then become argumentative and stubborn and narrow-minded. So there's a history like that. So sepia, the cuttlefish use the ink for different purpose. One to escape, and the next one is hiding, to hide them, to hiding from the predators, and the same time the ink, different color of inks they use for to the mating, the dancing and all, right? The cuttlefish has no sedentary behavior. They won't sit in a particular the spot. It always in motion. It always moving here and there, except when it need to be entirely still for defense. When they hide, that time they kept quiet. Otherwise, they always move. It swims slowly forward, but it can also swim backward too, right? Similarly, the sepia individual does not sit in. They are always workaholic. They always move. They always move here and there. They work from day and night, right? They're dancing. They do exercises, right? So that kind of picture you can see. They want to get away from intimate emotional attachment and responsibilities that come with them. So like that. In 1834, the Hahnemann, right, a patient came, a painter. The Hahnemann provide information on the homeopathic medicine. He discovered the solution after seeing that an artist person who licked his sepia soaked the paintbrush, right? So the painter who always used the cuttlefish ink for the painting, right? Then he developed some kind of problem. So after that, the Hahnemann came to know that, then started patented this remedy, and it's become a popular remedy in homeopathy. See the cuttlefish again. If you see the anatomy of cuttlefish, it's a very, right, like a very important, the organs are there, especially brain. The sepia brain, the cuttlefish brain, very intelligent brain, fully developed brain, very sensible brain, right? If you go to the Google and search all these things, you can learn a lot of things, right? This is the case again. See, what is that? Everyone knows that. Vitiligo, leukoderma. The girl, age of maybe around 10 to 12, around 11 or 12 years of age, see. So I prescribe sepia low potency, 6C. Then after that, you know what happened. See, here also there's a small spot, white spot, depigmentation. Here's a very huge depigmentation, vitiligo. So after prescription of sepia, 6C, low potency, slowly it's improved. You can see slowly it's reduced the color, you change the color, right? And see, after 2 months, you can see completely, not completely, almost 50% gone. Here, that's also, it's almost gone. See, you can see here, after 3 months, see, there's no depigmented area here in the nose, and here almost gone. See? So it's a low potency, right? Okay. So this is a very interesting case. Only 3 months I prescribed. First 1 week 6C, then placebo, then 1 week, then again another 1 week 6C, then placebo, some biochemic, right? Then, so like that for 3 months I maintained this case. After 3 months, completely cured. Then the another very interesting case. This is the case of skin. This is a case of skin completely. They diagnosed where the dermatologist they diagnosed as a dermatitis, right? You can see the report. They did some the biopsy and all these things. The report is there. Dermatitis, severe eczema, right, in the both leg. The patient has the lady age about 46, again the menopause age, burning pain, thirstlessness, burning pain on and off in the abdomen, and it's extend to the upper part of the chest, and then the burning pain ameliorated by eating, full of worries about her relative, and financially she was wealthy before, then some problem comes, though financially some kind of worries, financial worries, domestic worries, so like that. And after the financial problem and all these things come, the menopause and everything, so then she started the different story, different picture, right? The indifferent, right? Very melancholy, those kind of fear of being alone, fear of being in the darkness, those kind of regular, you know, the symptoms like severe symptom. Sometimes she want to escape, right? Desire to escape from here somewhere. So like that, because a lot of problems she has because of the menopause, you know, that is one of the important things, right, in the menopause period. So why these things happen? When you go into deeper into the CBR, this is the case. See, this is after getting cured. So before this was the big patch, and slowly is improving. This is completely, the whole leg was eczemated. See, the improving is there. See, this is another case. I'll tell you later. Okay. So in the sepia woman, especially now we are going to discuss the other side of unknown type of sepia, unknown side of sepia. Sepia woman during transitional. What is transitional? It's a very important thing, important word. Transitional means from one period to other period, right? From that girl, you know, from normal age to menarche age, menarche. Then during pregnancy, the problem during nursing, after miscarriage, after abortion, then during menopause, during and post menopause issues. We have to think of sepia. Then the washerwoman remedy. The M.L. Tyler explained why, because It's not the washerwoman. Don't think that washerwoman means just washing the cloth and all. No, it doesn't mean that. That is a working class, highly hard work, working class woman. Whoever comes, think of Sebia, right? So aggravated by laundry works, aggravated by hard work. So that's why they mentioned that washerwoman. Most of the time we think that we teach the student this is only for washerwoman ladies. No, that is not the meaning. That real meaning is a working class woman, hard working woman. That's all. So, and the Sepia is the sister of Naxomika. So many of our professors, they used to call it the sister of Naxomika, very irritability, shouting, anger, ailing. Desire not fulfilled. Sepia desire not fulfilled. Stasis in life, stagnation and routine. So everywhere stagnation, even Venus stagnation, everything, right? Stagnation, mind stagnation, lot of stagnation. The journey of life, there's a lot of stagnations, right? A lot of block, lot of the barriers. So they have to face. Now, everyone know the sepia indifferent. So in all materia medica, right? All viva, all oral, whatever it is, if you won't tell about these things, then they will put the right wrong marks, or you can't get the marks. That's why sepia indifferent. Why this happened? Did you right? So we have to understand why the sepia patient comes like that. When you understand the journey from normal lady to indifferent state, indifferent lady, why it's happened? The other synonyms of indifference called not interested, not attachment, no attachment, without interest, no commitment, emotional stasis, no emotional movement, emotional stasis, right? Emotional block, detached, disconnected, no affection, apathy. So these are the word, right? In materia medica and repertory they use to describe the indifferent, right? Don't think it's a single word. You can, right, get some idea from whatever the patient language, from the patient language, from the understanding of the patient. The evolution of sepia lady, how the lady developed, the sepia, the picture developed, right? So before, there are two things. One is manipulated by others, then manipulated by herself. There are two things. The sepia lady developed, right? The journey of the sepia. Very industrious, very hardworking housewife, exhausted from domestic responsibility, over workload, lead to irritability, restless, and very anxious. Fastidiousness, very clean. Before she was very clean and tidy, well organized, like, arsenic album. She was like, before she was like arsenic album. Then the picture slowly changed because it's manipulated by herself, suppressed her emotions herself, forced her to do the others willing, the husband willing, the mother-in-law willing, the parents willing, those who are around her, the teachers, all right? So that kind of, right, they imposed, they forced her to do it. You have to do this one, you have to do like that, you have to do like that. They are very ambitious, having strong desire before. Desire for success. They have that desire to achieve the things. Desire of power and wealthy. Very independent, active woman before. Irritability, the hormonal dysfunction, aversion to the relationship, unmotivated, aversion to the family, aversion to the husband. So slowly the journey is going, right? You know, you can see the picture, right? What do you call it? Puppet, right? Puppet. Later, an indifference developed and transformed into, because of these motivated by herself and motivated by others, so she developed the indifferent. So this is the story of indifferent sepia. Then she become sluggish, dullness, weakness, weak memory, ambition, all ambition and achievement, everything is lost. The aversion to the business. Before she was very, right, workaholic. See, aversion to business, aversion to the people. Finally, the sepia end with the, not loading, that's a spelling mistake, loathing life. Loathing life. Right. See, next, how it's happened. So slowly, the patient developed like that. So this is the real picture, right? In materia medica, these things you can't see. These things you can't study in the materia medica. How the indifference develops, how the sepia develops, how the journey of lady, how it comes, how these pictures arrived. This is a very interesting. Go into deeper and deeper into the patient history. Then only you can understand all these things. Then sepia, not interested in marriage. This is also very, 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 very interesting thing, right? Not interested in marriage and having children. May contemplate divorce as the solution. Finally, they end up with, because they end up with loathing life. Then here in the marriage, right, the divorce, aggravated by consolation, feels better by working, ameliorated by vigorous exercise. They have to do the exercise, walking, all dancing, right, continuously. See, fear of poverty, that is one of the best remedy. I think there are only 1 or 2 remedies in fear of poverty, right? Then the complaint starts after, never well since. The hormonal changes, you know, the transitional period. When the hormone change, right, during menarche, pregnancy, after delivery, then menopause, so different stages of the life. Then hormonal therapy. Some people, they take different tablets, for thyroid tablets, the birth control pills, all kind of things, right? So it changed the personality of the person, the personality of the picture of the individual. PMS, post-menopausal syndrome, post-menstrual syndrome, vaginal discharge, yeast infection, one of the best remedy for yeast infection and vaginitis, postpartum depression, uterine prolapse, bearing down, everyone know that, bearing down sensation. Then we'll discuss later how the bearing down sensation comes, right? Birth control pills, see. Then everyone knows about this, the sepia, right? Melasma. What is melasma? The brown pigmentation, shadow across the bridge of the nose and cheeks. This is another important, right, keynote of sepia. Sepia wants to work continuously, a workaholic that we discussed. They will do their career to fulfill their goal and continuously working day and night. Neglected their health. Because of that, they are not worried about, they are not bothered about the health. So due to that, the picture comes, the sepia complaints starts. Due to this, the balance in the family relationship may be disturbed and ignore everything. She ignore everything, ignore the health, ignore the family, ignore the work. So neglect to ignore what's happening around them, around her. She doesn't know what's happening around her. So it's a purely, right, escaping situation, like sepia, ink, spread the they spread the ink, spread the dye into the water and escape. So that is the nature of the sepia. So like that, finally, the person, the sepia lady end with that. Dr. Danesh, what's the time limit? Dr. Danesh?
Yes, we have half an hour for, you can talk 15 minutes.
15 minutes, okay. Okay, thank you, Dr. Danesh. So what is the melasma? Melasma means this is not only in sepia, but generally, there are some other causes too. If you see, go into the pathophysiology, right? Most of the even people anti-seizures, anti-epileptic medication, that's also change different things in the body. Contraceptive therapy, birth control pill, estrogen. Here you can see estrogen and hormonal, right? The inductions. Sometimes 33 to 50% of people, they get genetically, right? The hypothyroidism. Sepia, one of the remedy for hypothyroidism, you can think of hypothyroidism and the other remedies too. That the exposure of the LED, recently they found out the person who, right, continuously exposure of cell phone like that, and the television, laptop, all LED lights, it's may change your melanin, the physiology of melanin and different kind of things. And pregnancy, right? During pregnancy, you know, the changes of estrogen, progesterone, and different kind of the hormones in the body. So that is also a transitional period. You can think of sepia. Then the makeup, cosmetic. Sometimes most of the people, they come with the nowadays, right? Beauty parlors, they use different kind of toxic the cosmetic makeup chemicals. Then phototoxic drugs, skin products, so like that. Then the sepia, the occupation-oriented goals, they don't like to depend upon her husband financially and emotionally. So always they want, the sepia, they want to independent. Right? She feels her body disfigured. I'll tell you, right? I read this book. I think many of you have this book, right? The Homoeopathy, the fundamentals of its philosophy and essence of its remedies. It's the book author written by William Gutman. William Gutman. So he explained very nicely about the sepia, right? The sepia, it could be best described by clinical term ptosis. So everyone, you are familiar about the ptosis, you know, ptosis of the eyelid like that. So here, the author, he used the term ptosis in different part of the body. Ptosis means dragging down, bearing down. Now you can understand, right? Bearing down. We observe a mental, emotional, physical condition of ptosis. Dropping down everywhere, dragging everywhere. That is bearing down sensation. So dropping of eyelids, dropping of facial muscles, flabby abdomen, right? All the muscles have become loose. Organs, internal organs, they feel dragging down, bearing down, right? Emotionally, not only in physically. That's why she feels her body discovered. Physically, little disfigured, not discovered, disfigured. And mentally also, how it's being this ptosis or dragging or the bearing down sensation, right? The patient feels being dragged down by others, dragged down by the family members. They don't care about this lady. They pull down, drag down. In the workplace, all of them, they drag down, try to drag down her. Great dejection. That's why great dejection, the indifferent. right? Sadness, all gone sensation, everything is gone. Sensationally, emotionally, and right, financially, everything is gone, right? Feel emptiness. See, very interesting things he described. The characteristic sensation of lump in the ball, lump or ball in the internal organ and dragging down. Relaxation of all ligaments which hold the organs. It become loose. It become right, strengthless, weak. So that's why the internal organs, everything is coming down and dragging and bearing down sensation. And the ink of the cuttlefish, right, essentially is a melanin. Very interesting things. It's contained melanin and sulfur and ammonia. There are main the color, the main ingredient of the ink is melanin and some sulfur, then ammonia, like that. So that's why I gave this the previous patient, the vitiligo, the girl, the same thing, melanin, right? The chemically, the melanin contains sulfur, the ink contains sulfur and ammonia too. The sepia skin, even sepia skin looks like mild, you can see the mild margin, mild differentiation between sulfur skin and sepia skin. So like that. So there are things you have to understand, right? She does thing whatever her husband says and is forced to do the things to fulfill her husband wishes, her husband idea. He worked, right? He just forced because of the husband ideology, but does things against her will. She doesn't want, but she do the things because of husband says. So constantly dominated by another person. And when this the patient, she says, doctor, because of my health issues, I cannot concentrate on my work. Before she was not like this. Before, right? A lot of my works are bending, right? Narrated symptom with weeping. Then the weeping starts. The emotional, then the emotional plane starts. See, what is this one? Tell tall face person. Sepia, one of the important symptom, telltale face person. What is this? What is meaning? So who reveal other secrets? People, they do gossips. People, they do fault finding, right? See that, you can see the face, right? This I got it from Google. And the great fear of being alone, meeting friends and strangers. All gone sensation in the stomach, epigastrium, but relieved by eating. So here, bearing down sensation. That's why the sepia woman, they sit across, right? They put the leg across, one across the leg, right? The bearing down sensation in the mind feels others putting her down. I told you before, right? Like a slave. The people, they consider her like a slave. That's why the washerwoman lady, right? The story comes, right? They put her down like a slave and consider as a servant. It's a very, very interesting thing, right? The physical figure also going down, especially due to or after pregnancy, after menopause, right? So that's why the problem. Financially also going down. That's why the fear of poverty. Don't think like simply in the symptoms. Don't, right? You have to go into the each and every symptom, analyze why these symptoms comes. What is the relationship of this physical symptom and the mental symptom, right? Being dragged down sensation. There are a lot of things interesting, right? Next, sepia, camouflage, changing colors. Here, escape. Why they change the colors? The cuttlefish. To escape, for the survival, for the protective mechanism. This is the keynote of animal kingdom. Survival, escape, protective. This is the keynote of animal kingdom. Change the color of itself and change the color of environment. Both. Sepia patient also the same thing, right? He changed himself and change the people, those who are living surrounding too. And this is a very interesting thing I learned from one of the, right, the YouTube. See, you can see what's going on here. This is the sexual dance is going on. You can see. See? Even single, one sepia change different colors. When they are ready to have sexual contact, sepia female starts dancing to attract the male. This is a very interesting thing I am going to tell, right? Please listen carefully, right? Attract the male. Many male sepias come into the field and mating the party. They start the dance, right? Then the female sepia has chance to select the correct partner. There are 10 to 15 of sepias, male sepia comes and they dancing with the female sepia, and the sepia, she has to select the male partner. In between, you know what happened? Yeah. Even at that time, right? Even at that time, still, they forced female sepia for sex. See the interesting things, right? And male did a lot of tricks to attack the female. So they do best dance and best color, so like that. Sometimes the other male forcefully ejaculate. See the important things here. Without the permission of the sepia, without the permission of the female sepia, they inject they ejaculate the semen on the female sepia. It's like a rape, right? See, interesting. The dreams, sepia dreams. What's the sepia dreams? Dreams of rape. I think only 1 or 2 remedy has dreams of rape. That is the best remedy, right? That sepia is one of the things. But sepia has capacity to special natural technology. The cuttlefish has special natural technology to select which partner's sperm go into her body. See, there are 2-3 male sepia, they try to ejaculate the sperm, but this one, they try to raping the sepia, and the female sepia, it has capacity to select which sperm is going inside, which sperm which sperm go inside and for further fertilization. So like that. So very interesting things you can see. The same thing in the personality of sepia drug picture, right? See, mind manipulation, forced to do the things, changing and transition. When the changing period or transition period, if the person comes with a complaint, right, give him sepia. Very active, night aggravation, quick action, very intelligent, right? Here, the another interesting things, when you consider the emotion of sepia, emotion of sepia wants to cry more but dislikes sympathy. She doesn't want sympathy, right? See, aversion to consolation, weeps when the contradiction. Sepia weep only when the contradiction comes. Otherwise, sepia won't weep. But the pulsatilla, if you compare with pulsatilla, bala, 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 it's coming like that, you know, right? The tears comes like that, weeping. But very interesting things, this pulsatilla patient, when they enter into the doctor's chamber, into your chamber, she sit, right, very close to you, right? Comes closer and sit to close to you, close to the doctor, and starting tell the story. And they reveal the stories with the weeping. While telling a complaints, weeping. But why? Because they comes too close. Why they sit close to the doctor? Pulsatilla wants to get consolation. She wants the doctors also feel, right? We have to feel that. If you are simply sitting and like this, the Sebia, the Pulsatilla lady just simply she went, she left the clinic and went away. So you have to feel, oh, abriya, oh, like that. So you have to feel like that, right? Then Natamure patient, that's entirely different. She entered into the chamber and pulled the chair. She pulled the chair and she wanted to keep a little distant to the doctor. Why? Because she wanted to maintain distance from the doctor and started talking. When you touch a particular emotional subject, particular emotional things, then she started, Natamure patient, she started weeping. Natamure patients, consolation, aggravation. They don't want consolation. They don't want sympathy. Because she wanted to maintain distance from the other person and even to doctors. The Natamure, the emotional, they want to maintain the borderline between, right? The distance, the borderline between patient and doctor. But Ignatia, see other picture. This is always melancholic, silent grief. See, there is no weeping, continuous weeping. You can see the picture here. Only few drops comes. Only few drops comes and stay there. It won't come like this. That is Ignatia, right? They suppressed all the emotion. Inside suppress all the emotion. Ameliorated by weeping, neglected feeling, affectionate, homesickness. So like that. So, can I finish? Time is over, right, doctor? So any questions?
Yes, definitely. We will have how many time? Just 5 minutes only. We can.
No. We can go for a discussion.
Yes, that's good.
That's good.
That's good. We can have some continuation of the session in some time in the last week of August or first week of September, as per your convenience.
Okay.
Anyway, it's really
I'm always with you. Right?
yeah.
Keep me occupied in Sunday.
Anyway, it's
Any
really
comments? Because this is the different aspect of Sebia. I think many of you know, but my explanation and my ideology to
yes.
understand the patient and picture, to compare with the patient and picture is different
Really,
concept.
yes, really a beautiful presentation indeed. Because the color changing aspect of the sepia is not only in the physical, but there is in the mind. She is really a different personality. That's why we say that this particular person was indeed a very good person, but all of a sudden she become a different person. Why she is reacting to me like that? Doctor patients used to say that, oh, my wife is a very nice person. She used to care every time. But nowadays, she won't allow me to touch even her body, or even she won't like to. Whenever I talk something, she may shout at me, or sometimes she may leave me alone like that. Why these things happen, doctor? I don't think that I have done anything wrong with her, but she's behaving like that.
Yeah.
So, this is what we used to say find in our clinic every day, because whenever the person comes to our clinic, when we open up the case, we can find such ladies sitting in. If initially they may simply say that, oh, I have no problem, doctor. I have no problem with anyone. But when we when we interact with the husband or the family members, then we find that she is a different person and not what the person who is sitting in front of us. That's the beauty of case taking, and really a deep case taking will reveal the right person. As you pointed out, the sitting erect itself is an indication of a sepia woman, and that itself will directly uh, direct to the medicine, even without asking a funny question, because you
Yeah.
can understand she may be thin and maybe fat, but she is a workaholic. Always she does her work, does regularly. But whenever, even in the sex also, she enjoys sex, all type of sex in
Yeah.
the early part. But when things are different, these things will be different when she goes to the menopausal age, and she may go for prayers and all those things like that. She may shift the focus from one to other, just like
Yeah.
that is what you call this as a color changing aspect of the sepia lady. Anyway, there are persons who want to may talk. Since the time is short, I am not explaining any of my cases. We can have the presentation in the later. I think we can have the second part of the same. Then only we can. Even in our Malayalam session, we had discussion for about some 6 hours for this Sepia alone. That was thing is there in Sepia. Uh, you have shown some other aspect of sepia also. That means that the sepia is a never ending story. Like, I
Yeah.
invite Dr. Rambarisa to say a few things of
Thank
in.
you. Thank you, Dr. Dinesh, and congratulations, Dr. Paul Joseph, sir. Very, very thanks.
Namaste. Namaste.
Excellent
Namaste.
session. Excellent session. Beautiful describe of Shipya medicine, nature. Shipya medicine symptoms, objective and subjective symptoms. Very nice. Uh, uh, Actually, Shipya patient is hormonal disbalance.
Yeah.
Hormonal disbalance. Dis- deficiency of electrical energy. Electrical energy deficiency, then hormonal disbalance and symptom bodies, sepia ladies, fastidious nature, tall tail face person. Very good.
Okay, sir. Okay, sir.
Symptom,
Thank you.
tall and tail person. Very
Oh,
nice, very good, and bearing down sensation is a very good symptom. And weakness.
okay,
Thank you,
sir.
very, very thanks, Joseph sir. Very
Okay,
nice presentation. Behalf of
okay, sir.
IF,
Thank you. Thank you.
IFP,
Thank you.
uh, thank you, sir. IFPS again presentation. Thank you, very, very thanks.
I invite Dr. Boblin to say what are thanks to the session. Dr. Boblin.
On behalf of the IFPH, I would like to say a very big thank you and our deepest appreciation to Dr. Paul Joseph from Canada, who has given us a very in-depth discussion about this dye. It comes from the cuttlefish, and it's named sepia. And so he have a very, very in-depth discussion, and with all his knowledge, he have comparative differentiation diagnosis with the sepia and compare with other remedies. So like Dr. Daniel says, we hope to have him to share his knowledge again, because that sepia alone, it takes a long time to discuss it. So we are waiting to hear from you again, Dr. Paul Joseph. And once again, thank you very much on behalf of the IPH. It's a
Very good.
1134th Zoom meeting webinar. Thank you very much. Over to you, Dr. Danesh.
Yes, fine. Thank you, Dr. Bob Lim, and thank you, Dr. Paul Joseph, and those who attended the session. Tomorrow we will have a session from Dr. Arpita Chatterjee. She will be talking about understanding the psychology of patients with general anxiety disorder and its homeopathic approach, part 2. With that, we come to the end of the day, 1,434. Thank you all. Good night.